Imagine you went to the hospital for stomach pains and your doctor prescribed you this: putting a tube up your butt and having someone blow tobacco smoke directly into your anus. Doesn't sound very fun, does it? Technically called a tobacco smoke enema, this was a very real treatment for many in Europe in the late 1700s to early 1800s, and I want to tell you about this very fascinating detour in medical history. But why tobacco smoke? Likely for the way it affected the body, which brought about a warming and energizing sensation, which was thought to stimulate respiration and amp up overall organ function. Why the butt, not the mouth? And it's a great question. I'm glad you asked it. Now, there is some logic here. The colon was thought to be more absorptive than the stomach, which is actually true. The stomach's main job is to break things down, not absorb them. So yeah, the colon definitely outranks it. Therefore, creating a shortcut to the colon via the rectum was considered a more efficient route to administer treatments, so they were absorbed and started acting quickly. Now, returning to the rubber tube setup, I'm sure you can imagine how this might go wrong. When sucking in the smoke, even if not inhaling all the way into the lungs, there's a chance one might cough. What do you think happens if you accidentally have a coughing fit while your mouth is connected to somebody else's butt by a tube? Yes, you inhale poop particles. And this is somehow actually worse than it sounds because cholera was rampant and actually endemic at the time. Cholera's main symptoms are diarrhea and vomiting, and the infected person can die via dehydration because of these symptoms. And how is it spread? By my least favorite route of infection, the fecal-oral route, by which I mean you get poop particles in your mouth, which is exactly the situation we had here. Obviously, people quickly spotted the link between the butt tubes and cholera spread and thought they needed a better way to administer this treatment, which was good thinking. This led to the modification of the tube with an attachment called a bellows, which is an accordion-like device that is supposed to deliver a controlled but very strong blast of air. These bellows soon replaced human lungs as the main delivery mechanism for the tobacco smoke. Woohoo!